We will now go into our routine 8:35 item with public health and our COVID update. And we have Kathy and Jamie here again this morning. Good morning, Kathy. Good morning, Jamie.
Good morning, Mr. Chair and Commissioners. We handed out the usual weekly form with the data. The thing of importance that we see is the active cases are down from last week. They were 120 last week. They're now at 90. So we're seeing more people, less cases, and more people getting out of isolation. The 14-day case rate is something we have been watching as well. That is at 25.96. That's still low. It's a little bit higher than we saw last week, but it's also a 14-day case rate that's delayed. So we're going to see probably a reduction in that the next week, the 14-day case rate, because of the 90 active cases. So that's looking good. Hospitalizations are stable, and our deaths are at 89. They were at 88 last week. So we had one additional COVID death that was recorded. And so Minnesota is also seeing less numbers increase, so we're pretty stable with the numbers that we're seeing so far. The active cases by age range on the next page just shows where we're at currently. And the 25 to 29 are still the ones that we're seeing the most active cases in. And then the 60 to 64 bumped up a little bit, and the 30 to 34, but it's routinely the 25 to 29 this week. Cumulative cases are the 20 to 24, so that's on a general scale. The age range, hospitalizations again remain low, and the deaths, we had that additional death that was recorded from last week. And then hospitalizations in ICU again, stable across Minnesota, and also currently within our region. We meet with the hospitals and on our Red River Valley Task Force, as well as the North Dakota side, and so things are pretty stable across our metro area as well. And now I'll let Jamie, unless you have questions about the data, Jamie can talk about our vaccine administration.
Mm-hmm. Good morning. Okay, so looking at the data for total number of people with at least one dose of vaccine, in Clay County, we're at 20.5%, and statewide, 22.7%. Total number of people with completed vaccine series, 10.7% of the population in Clay County, and 13% of the statewide. People aged 50 to 64 with at least one dose, 29.4%. in Clay County and 22.5% in Minnesota. And then people age 65 with at least one dose of vaccine, 69.3% in Clay County and 75.6% in Minnesota. And then the total doses that we have administered by Clay County Public Health to date is 7,785. And then we've got the graph down there at the bottom that shows you that we administered 897 doses. We did receive less last week, and that is 578 of those are first doses, and 319 of those were second doses. And so our plan for this week is 1,700 doses. We have 200 of those that are second doses, and then we were offered 100 doses, and we begged and pleaded and received 1,200. So that's what we will be doing this week. We are continuing to focus on adults age 65 and over, anyone with underlying health conditions, and then workplace risk exposure is what our priorities are. So in Tier 1B, we have those with rare conditions or disabilities, and in Tier 1B, in Phase 1B, Tier 3, people age 45 to 64 with one or more underlying medical condition, and people 18 to 44 with two or more medical conditions, and then also people age 50 years or older living in multi-generational housing, which is not just a grandparent raising a child, but more than just two generations. And that's it. Otherwise, what we're doing is we're reaching out to food processors and those priority groups that are in Tier 3, and inviting them to sign up on our sign up. On the county website, we've got a link where anyone can go and sign up, and what will happen is when you're eligible for vaccine, we'll push that out to you to register and sign up for an appointment, so.
Go ahead.
Thank you, Mr. Chair. Looking at the data, because the majority of the folks getting the vaccination obviously are of older age, and so now we're seeing more active cases with our school-age youth type population. In your conversations with the schools, are you hearing percentages of teachers vaccinated? I mean, do we have a rough estimate on what you're seeing with the teacher population?
You know, all the schools in Clay County were offered the vaccine multiple times, so everybody that was in E12. Some received it in other locations, some received it from us, but everybody has been offered, and when we meet with the superintendents, they're confident that everybody that wanted the vaccine has received it. So
Okay.
they didn't give us the percentages of what they thought teachers that received it, but they really felt confident that they've had plenty of opportunity to receive the vaccine.
And then my follow-up question would be, I have heard that a booster shot for this will be required down the line. I know it might be a lot to think about right now because we're dealing with the first round. Are you anticipating a booster shot needing to happen this fall when people are typically doing influenza boosters? What are you hearing on that?
You know, we're hearing nothing about that
Okay.
from MDH at this time. They said that, you know, the information is still being vetted out, but they have not provided any information about will there exactly be a booster this fall or not. So we haven't heard any. I know we hear rumblings in the national news, but nothing directly yet.
Well, and that's fine. I just want to make sure, as we all saw, the president signed the new recovery, and Clay County will see some funds come to us. And as we deal with the effects of COVID and the costs that the county may incur, I would guess that those next rounds of vaccination would be costly. And I want to make sure that the CARES Act committee takes into account what the continuation of vaccination will cost. So I appreciate it.
Sure, thank you.
Commissioner Gross.
Yeah, as much as I like to hear Kathy and Jamie talk here every week, I was just wondering if our weekly reports are still necessary. I mean, could we go to every other week, or, I mean, the updates are, I mean, COVID is important, but do we need to report every week to show that we got 20 more of this or 10 more of this, or whatever the case may be? I'm just wondering what your feelings are. Do we want the weekly reports to continue? Because we're taking up their time doing it too, so.
I guess my feeling on it is I think we could have the materials provided to us. However, because the vaccine issues are constantly changing, I still think it's a good thing for our public to be able to have this as a resource to find out information, and your report to this board, it's played back, and you know, it gives all of our citizens an opportunity to, I know you're plenty busy and you'd probably rather not be here at times when there's many other things to do, but I think it's important. My feeling is it's really important for the public to be able to get that information on a weekly basis. Some of them have probably come to depend on getting it from here, so. Commissioner Ebinger.
Yeah, I think there's, and this is a euphemism we've heard a lot, there's light at the end of the tunnel. But I think the next month or 6 weeks, particularly getting through spring break, there's going to be developments that we need to be aware of that may impact our community, especially with the college population we've got. And with once the J&J gets here and the resurgence of some really large opportunities to vaccinate, I think the board being aware, or the commission being aware of what's going on and being able to react to help get locations or whatever we need. I think maybe 6 weeks from now we'll really be hopefully looking at toning it down, but I think there's going to be some breaking issues until we get into the summer that we really ought to be apprised of and be able to respond to.
Mr. Chair?
Yes, Commissioner Kayla.
I kind of agree with Frank. I feel like as soon as we can start cutting them loose a little bit so that they can focus on getting as many citizens vaccinated as possible and instead of coming to meetings, that would be great. So as soon as we feel comfortable as a board with less updates, that would be a good move to make.
And I'm not trying to lower the, I mean, we need to have information and stuff like that. It's just that we're looking at weekly reports that go up a little bit, or down a little bit. And I was just wondering whether it's necessary to take up their time. And I'm okay with these weekly reports. I mean, I think it's very important that we're up to date on it, but just wondering whether.
Well, I do know too that one of our newspaper outlets locally here watches these meetings on a regular basis, and and in their weekly paper that they put out, they put a recap of what's been talked about.
Yep.
And so this is a source for our media to also get some additional information. And at this point in time, I'm inclined to say let's keep having you come here, and as Commissioner Ebringer said, let's look at it again 4 to 6 weeks and see how it develops.
I'm fine with that. I mean, I'm just brought the thing up to see whether.
No, it's very good. No problem. Any other questions for them this morning?
Not a question, but just on your graph, as we all noted, 3/15 of 2020 was the first week that you'd given a report, and here we are, a year passed, and I know we say this often, but continued thanks to you for your work in the community. We really appreciate it, and certainly would not know where to be without your presence in the community, so thank you.
So I had one last thing, and thank you for the email, Kathy.
Little delayed.
So last week I asked a question on behalf of someone regarding if they've had the vaccine, if they can test positive. And your answer in your email to me was, no, they cannot.
Correct.
So those who have been vaccinated and they want to go to
Florida.
leave the country or whatever, in order to get back, they have to have a negative test, and at least they won't show a positive test from the vaccine.
And my understanding is you might be okay going to Hawaii because you're still within the United States, so I think you're okay.
Well, that only applies to one commissioner.
The only
of us
place
have
I
to
go
stay
is
here and
Southern
work.
Clay County.
My research indicates as long as I pass a test within 3 days of arriving in Hawaii, they won't make me quarantine for public information.
All right, well, thank you.
Yep, thank you.
Kathy,
Thank you very much.
Jamie, we'll see you again next week.
Yep.
All right, we are early for our public hearing.
I'll take the agenda, Tishan.
Yes, yeah, let's do that. Let's take the